Cancer's rapid rise in incidence has sparked a heated debate. Is it a coincidence tied to lifestyle and environment, or does it hint at deeper conspiracies involving industries and medical practices? With over 2 million new cases expected in the US alone in 2024, the urgency to unravel this mystery grows. But what lies beneath these numbers? Natural trends or something more sinister? In this video, we'll take a deeper look behind cancer's rapid spread. Each day, thousands receive a life-altering cancer diagnosis. The statistics paint a grim picture in 2024. Approximately 2,001,140 new cancer cases are expected, alongside an estimated 611,720 deaths due to cancer. This means around 5,500 new diagnoses each day. Certain cancers, like colorectal, breast, and prostate, are showing disturbing increases. For instance, colorectal cancer has become the leading cancer killer among men under 50, a shift that demands scrutiny of diet, sedentary habits, and exposure to harmful substances. Such changes bring about the question, are our modern lives setting us up for disease? Research indicates that the rise in early onset cancers, those diagnosed in individuals under 50, has been particularly pronounced since the early 1990s. A study conducted by researchers at Brigham and Women's Hospital revealed that cancers such as breast, colon, and liver have seen dramatic increases among younger populations. Scientists point to the birth cohort effect, which suggests younger generations face higher cancer risks due to cumulative exposures over their lifetimes. The Western lifestyle is often cited as a significant contributor to the rising cancer rates. Increased consumption of processed foods, high in sugar, and unhealthy fats has been linked to various forms of cancer. Obesity alone is a known risk factor for at least 13 types of cancer. The World Health Organization estimates that up to 50% of cancers could be prevented through lifestyle changes such as maintaining a healthy weight, engaging in regular physical activity, and avoiding tobacco use. Yet the disparity in cancer outcomes across demographic groups reveals a more troubling picture. Black communities, for instance, suffer higher mortality rates, not due to biology, but because of inequities in healthcare access, education, and prevention efforts. Imagine the lives that could be saved if these gaps were closed. Addressing this disparity demands a more robust healthcare infrastructure and greater investment in community education. However, the systemic challenges remain daunting. Advancements in screening and medical technology complicate the story. While early detection boosts survival rates, it also inflates incidence statistics. Increased use of mammograms and colonoscopies finds cases that might have gone unnoticed before, making it hard to tell if cancer is genuinely on the rise or simply being caught more often. What if this is just the tip of the iceberg? Many cancers caught early through screening may have been non-lethal or slow-growing, a phenomenon known as overdiagnosis. While it's better to be cautious, this trend creates a misleading narrative that cancer rates are exploding at unprecedented levels. The question of whether the rapid rise in cancer rates is a coincidence or part of a conspiracy is complex and layered. While some people may lean towards conspiracy theories, particularly in the wake of the COVID-19 pandemic and the emergence of concepts like turbo cancer, the overwhelming consensus among experts is that these claims lack scientific backing. The term turbo cancer has been propagated by anti-vaccination advocates who allege that mRNA vaccines are causing an increase in fast-developing cancers. However, these claims are not supported by credible research. The U.S. National Cancer Institute has stated unequivocally that there is no evidence linking COVID-19 vaccines to cancer development or progression. This highlights a broader issue, the tendency for misinformation and conspiracy theories to flourish, particularly during times of crisis. Moreover, the belief that there is a hidden cure for cancer is another prevalent conspiracy theory. This idea suggests that pharmaceutical companies suppress effective treatments to maintain profits from ongoing therapies. However, statistical analyses indicate that keeping such a significant secret would be nearly impossible due to the vast number of individuals involved in cancer research and treatment. The notion that a monolithic entity could do such a cover-up ignores the complexity and diversity within the medical and scientific communities. Before we continue, make sure to subscribe and hit the bell icon for more updates. Let's move on with our video. The spread of misinformation about cancer has been exacerbated by social media, where false claims can proliferate rapidly. A study highlighted that 81% of cancer cures promoted on TikTok were fake, with many using conspiracy theories to lend credibility to their dubious claims. This environment fosters distrust in healthcare systems and can lead individuals to make harmful decisions regarding their treatment options. Many individuals believe in various mythical causes of cancer, often influenced by digital misinformation misinformation. A study revealed that nearly half of participants felt that everything causes cancer. Take Teflon-coated pans, which contain chemicals called PFAS. While linked to some health concerns, definitive proof remains elusive. Similarly, mattresses treated with flame retardants may release harmful chemicals, prompting a rush to replace them, often without solid evidence of harm. This confusion can lead to a propensity to embrace conspiracy theories, especially among those who are skeptical of conventional medicine or have been influenced by alternative health narratives. Even our personal care products are under scrutiny. Parabens, formaldehyde, and endocrine disruptors in cosmetics have raised alarms about potential risks. Despite growing awareness and the shift toward clean beauty, many remain unaware of the ingredients they slather on their skin daily. For instance, research shows that prolonged exposure to such substances can potentially accumulate in the body, though the extent of harm is still debated. This gap in clarity leaves consumers stuck in a gray area, unsure of whether to trust industry reassurances. Industrial pollution further fuels suspicion. Factories releasing carcinogens into nearby communities leave residents vulnerable. For example, increased cancer rates around industrial zones underscore the harmful legacy of poor environmental regulations. It's no wonder such scenarios breed theories of governmental negligence. High-profile cases like those involving PFAS-contaminated water in communities only add to the perception that industries prioritize profit over public health. Doctors often find themselves at the center of this storm. Tasked with explaining complex science to patients overwhelmed by misinformation, they face skepticism from those who believe in alternative remedies or conspiracies about hidden cures. This distrust can lead patients to reject life-saving treatments, opting instead for dubious alternatives that often worsen their condition. For example, individuals who turn to unproven natural cures may delay necessary surgery or chemotherapy, drastically reducing their odds of survival. Lifestyle shifts over the decades, such as reduced physical activity and higher consumption of sugary foods, likely play a role. But could environmental toxins also be at fault? Researchers are exploring links between modern chemicals and these cancers, examining how exposure to substances like glyphosate or microplastics may disrupt biological processes. These tiny particles, now found in everything from our water to our bloodstreams, represent a hidden threat we're only beginning to understand. Unfortunately, the COVID-19 pandemic has further complicated cancer care. Delayed screenings and treatments during lockdowns created a backlog of undiagnosed cases, which could lead to more late-stage cancers in the coming years. For many, this delay may prove fatal, underscoring the critical need for resilience in healthcare systems. So, is cancer's rapid rise a coincidence or conspiracy? The truth is both simpler and more complex. It's a mix of lifestyle and environmental factors, magnified by better detection and the relentless pace of modern life. While conspiracy theories might provide easy answers, they distract from the real work needed to combat this crisis. Doctors and scientists, armed with better tools and data, are our best allies in this fight. Together, informed choices and systemic change can turn the tide against cancer's alarming rise.